Exactly 2 years ago, myself, John Richardson, chairman of Mildmay, I was able to travel with our new then chief executive, Jeff Coleman, to Kisumu in Kenya to see the work that was happening in the training of community health volunteers who were bringing primary healthcare to the northern counties of Kenya around the shorelines of Lake Victoria. We had the privilege of spending a day on Mageta, which is an island in the middle of Lake Victoria. Access then was by a fishing boat, which to say the least was not very safe, leaking in many places when we lost the bailer. We then met the various people who were volunteers, and we met some of the patients who were being treated. We were amazed at the lack of facilities. The quality of the clinic was abysmal. There were no basic hygiene. There was very little in terms of medicines and of basic primary care equipment. It was staffed by volunteers and by one clinicians. We heard the stories of mothers who had to walk 14 miles before they could deliver their babies. And the appeal that we put out then was to buy a tuk-tuk, an ambulance that could take patients to the clinic on the middle of the island, which has been a great success. Since our visit, the only transport to the island was by ferry. But sadly, in the storms earlier this year, that sunk. So the fishing boats now are the priority. Access to the mainland is very tight and very limited. So this appeal for the peoples of East Africa, for this island of Mageta, is to promote more training for the community health volunteers, to provide more medicines and basic oxygen and other supplies that are needed to treat men and women and children, and also to provide more staff who are clinically trained, working alongside some tremendous, pleasant and hard-working volunteers. We hope that you will consider, even in these days when we may be cash-strapped, that there is a vital role to play. £1, £2, £5, £10 or even more will be greatly appreciated, and you can send it to the Mildmay Hospital at 19 Tabernacle Gardens in London. Thank you for your support, thank you for your prayers, and thank you for being with us in these days.